Hello to everyone listening. I'm Jo Francis, CoramBAAF's Publishing Manager, and today I'm talking to Vicky, Sharley and Alyson Rees about their new practice guide, Working with Children Who Have Experienced Neglect. This is a new book in CoramBAAF's popular Good Practice Guide series. Vicky is a senior lecturer in social work at the University of Bristol and a registered social worker, and Alyson is a professor of social work at Cardiff University and also a registered social worker. And as you'd expect from this book, they both have a strong professional interest in looked after children and neglect. So, Vicky and Alyson, your new book explores child neglect. How common is this in children and looked after children in particular?
Well, that's right, Jo. It is very common, but whilst it's common, it's also actually difficult to quantify how many children have suffered or, are suffering from neglect. Okay. But data estimates that it's around 1 in every 10 children in the UK.
Wow.
But it's a real challenge, often because it's difficult to identify and recognise neglect as a sort of a concept. And also on top of that, a child or young person or the family may not wish to share their experiences of what they're going through, or they may go further with lengths to hide them. But despite the challenges, neglect is actually considered the most common form of child maltreatment here in the UK, with just over half of children on child protection plans or on the child protection register are on there for child neglect. So if we're thinking about, in numeric terms, that's sort of just over about 29,000 children in the UK in 2020. So it's a lot.
That's an astonishing number. It really is.
Yeah. Particularly in relation to those children who are looked after. What we also know that the majority of children who are looked after, I would say around about 60% are in care because of abuse or neglect. And of course, those children in care would have previously been children receiving child in need services or those on child protection plans or the register.
No, I can see that it's clearly a very significant issue throughout the UK. And it can be easy to think we know what neglect is, that we'd recognise it if we saw it. But your book has taught me otherwise. What are we actually talking about when we say neglect? And I know this is more complicated than it might seem.
Yes, exactly. I think we all have our initial ideas when we hear the word neglect, what we think neglect is. We think about maybe dirty homes or detritus. We think about poor living environments for children not having enough clothes, maybe lack of hygiene. But when we actually stop to think more clearly in practice, how do we define what neglect is?
Yeah.
I think we need to think a little bit deeper. Our ideas of neglect, they can tend to be subjective. They're drawn from, the societies we're in, our ideas, our assumptions, and they tend to be rooted to experiences of, how we were parented in our childhoods, or maybe therefore how we go on to parent or care for children in our lives as adults. And this raises further questions about, what do each of us as, individuals or, in our professional lives, what do we deem to be adequate care? What do we think is good enough parenting? Some of us have grown up not wanting for anything, being very comfortable. Others of us may have had much more challenging childhoods where we've lived experiencing poverty or adversity, maybe inadequate parenting ourselves. And all these things feed into, what we understand neglect to be alongside our values, our ethnicities, our differing cultures and class, gender, all those sorts of things.
Yeah.
This all creates a very individual lens about the way we as individuals see and recognise what neglect is and what inadequate parenting or care is. So, this book really starts to take time to unpick the conceptual complexity of neglect and offer some strategies that may help professionals or carers, students, maybe even to reflect upon their own ideas of what they think neglect to be to inform their work with children.
Yeah, which of course is extremely important for all social workers who are coming into contact with this. Now, from what you've said, I can see neglect is hard to identify and evidence for social workers. And I know, obviously, you had contact with many social workers and others when you were writing this book. What sort of difficulties have they had around this issue?
Yeah, that's right. We did. We talked to a lot of practitioners and students about their experiences. But because there is often such, wide-ranging differences between different practitioners' understandings and definitions of neglect, this does lead to the identification of neglect, maybe in the first instance, being quite challenging. And when I say that, I don't just mean, those differences between those in specific professional settings and professional settings and backgrounds. There's also real significant differences of what is believed to constitute neglect across different teams within the same local authority or organisation. So we don't just see it difference across professional discourses. We see it really differing within the same local authority and within the same social work teams sometimes because of, these personal experiences that we've been talking about today.
Yeah.
I think, in addition, Jo, to the identification of neglect, it can also be more challenging to sort of evidence an omission of care or parenting rather than say, evidence an act or commission such as an instance of physical or sexual abuse where there's something that happens. There's an instance, something happens at a moment in time. Where for neglect, some of the key challenges for practice is that because it's the most prevalent form of maltreatment with severe and lasting, sometimes tragically fatal effects for children, being able to confidently articulate our observations and thoughts and, often intuition at times, this can be more difficult than we first thought. And, the challenge of evidencing whether or not what we're seeing is neglect, whether it's inadequate, and whether it's fluctuating over periods of time where parents or carers are making improvements at some points, and then at other points, things are not going so well. That's the real challenge there. So this book, what we're doing is we've drawn upon practitioners' experiences where they share their strategies about the importance of monitoring the care of children over time, recording clear and detailed chronologies that can help identify patterns in children's care, how they're parented, is it consistent? And that helps us really think about, what the appropriate level of support to offer the child should be, congruent with thresholds for intervention, but also to make sure that child receives the right care and the support at the time they need it most.
Right. Thank you very much for that. Yeah, I can see it's the monitoring. It's over time, as it's not just one instance, is it?
That's right. It's often not. It can be a single instance, but it's often over a period of time.
Right. So looked after children, they may have been neglected in their early lives when they're with birth families, and now they're in foster care or in kinship care, or they've been adopted. So how might this early neglect affect them later on when they're in a new family?
Jo, I've written mostly around this, and most of my research has been looking at sort of different interventions with children who've experienced neglect. I think the most important thing is to remember that they're individuals and that we can't know how each individual child is going to respond or is going to have been affected. And the thing is that each one is an individual, but children might be lacking in trust of adults because they haven't had their basic needs met or they haven't had consistent care. Children may be less confident about communicating with others, about talking in school, even about having friendships, because often if you've been in a neglectful situation, you may not have attended school regularly, or you might not have felt able to bring friends home because the home conditions were such that you felt embarrassed. So all of those things almost have to be learned again in the new setting. Some children may have some developmental delay in that they haven't met their ordinary normal milestones, and that also may impact on them. So I think a range of ways it might impact on children, and but each one will be individual, and it's about getting to know the individual child and understanding their perspectives.
No, I can see. So you say in the book that multi-agency working is really key when we're talking about neglect. So, for instance, social work, health and education. But we know this can be hard to do. So what do you feel is going wrong with multi-agency work here?
Vicky, would you like me to start, or would you like to respond first?
I could say a little bit, so if that, and then we could do it together, Alyson.
Yes, yeah.
I mean, I think it's really difficult to say that there's this one key factor that impacts upon the success or, the effective delivery of multi-agency working. That's the biggest, trickiest question to me. There are many, many factors. But when we're working with neglect in a multi-agency or interprofessional setting, this brings an added layer of complexity. We talked about our individual, professional, societal, cultural lenses, meaning that responding to neglect then again across agencies creates even more challenges of practice, because we're sort of looking at those organizational and professional lenses, on top of that. This is a complex area of practice. In this book, Alyson and I have dedicated a whole chapter to this topic, to really give us space to talk about its importance and unpick some of the practical challenges. How do we communicate ideas across agencies, but also, some of the more psychological challenges, like as individual practitioners, our ability to understand, make sense of information in our minds that's shared with us, receive it, share it again with others. So, the chapter we've sort of presented in the book, it focuses upon the importance of working with colleagues in universal services particularly. There's sort of an emphasis upon schools and this significant role. You mentioned, Jo, about, social work with education or health. So we look at social work with universal services, and we draw out some key messages from my own research, actually, in terms of working interprofessionally with schools, and think about, can we offer some helpful, useful kind of ideas and thoughts about ways which we can all as practitioners work more effectively across organisational boundaries. Alyson, is there something else you'd like to add to that?
I suppose it's about the importance of sharing information and not assuming that everyone else knows the same as you.
Yeah.
Vicky was talking earlier about really looking at a family over a long period and understanding them and seeing that wider landscape. And that sharing of information is really, really important so that everybody is aware of the situation and how it's changing and how it's fluctuating. And I suppose in terms of interprofessional working, for me, one of the big things is that foster carers are often not listened to or not seen as part of that interprofessional working. There's foster carers, and then there's the other professionals. And I've done quite a lot of research with foster carers, and they've often felt really outside of the loop of information sharing. And yet they're the very people who are spending all the time with the children and probably know them best. So for me, bringing the foster carer into that interprofessional working relationship and that team around the child is really important.
Are there any other particular good practice examples you'd want to share? I mean, this is clearly a really key area.
Yeah, well, I was involved in an evaluation of fostering wellbeing. And that was a programme which did training with social workers, health, education and foster carers all together, and listened to the voices of young care experienced people and foster carers. And that joint training really brought foster carers on more of a level playing field with the other professionals. And it started to build trust and get to know each other. And then afterwards, foster carers felt much more confident and, in fact, much more listened to and much more communicated with as part of that team. So I think training people together can be really important, and getting to know each other.
No, absolutely. I mean, as you say, if a child's in foster care, it's the foster carer who's spending the most amount of time with them after all.
Absolutely. And yet they're often not sort of given all of the information. They're often not part of those meetings, which were happening between social workers and education and health, for example.
Right. Now, your book has a chapter on ACEs, adverse childhood experiences, and I'm sure many listeners are familiar with these. I know the ACEs perspective is quite popular these days, but in the book, you argue that ACEs, it's not necessarily the best way of thinking about neglect.
No, I think I can be quite cynical about ACEs, in that I think they have the potential to be quite deterministic, and suggest that if a child has experienced certain things, then their future life will be impacted negatively, and that they won't be able to achieve. And that really worries me. It's not a particularly scientific study, the ACEs approach, in that it's, for example, maybe if you've had a parent in prison, this will impact you in later life. But it doesn't think about how long the parent was in prison and whether there's any sort of weighting associated with that, or which parent it was, or some range of different factors, and none of them are weighted. So it's really just sort of putting a lot of things into a bag and saying this will have mean poor outcomes for you as an adult. And as we know, lots of people who have experienced abuse and neglect go on to successful lives and to, really contribute to society. So what worries me is that deterministic aspect of it that might mean that we have lesser expectations and aspirations for our children.
Mm-hmm. No, absolutely. Now, your book, it has a lot of information about different approaches to use when you're working with children who've been neglected, such as therapeutic parenting. And I'm sure this section of the book will be very useful for practitioners and parents and carers out there. What are a few approaches that really seem to make a difference to children and families when there's neglect in the child's past?
Well, I think, again, it's about a very individual approach and listening to the child, getting to know the child and understanding the things that negatively impact them, but also what they're really, really interested in. And so for me, working with a child, listening to the child and harnessing any interests, abilities, capabilities that they've got is really important to help that child develop. So there are lots of different strategies, and I talk about PACE in particular, about a way of being when working with a child, about being playful, accepting, having empathy for that child. So it's very much about I suppose, a gentle, sensitized and individualized approach to working with children. One particular model that I like is video interactive guidance, and I've done a couple of studies about that. And it's a very non-intrusive intervention of working between a child and a parent to try and improve the parent's responsivity to the child. And certainly, if that's something that of interest to you, it's worth reading about. And there is a whole section about that in the book.
Right. Thank you very much to the pair of you. It's been a very interesting interview, and it is a fascinating book. Do you have any final messages for social workers when it comes to this subject?
I think, one message which I think is if I was looking back upon my own professional experiences in practice, for me, one of the most important things when, working with neglect in any context is the importance of opportunities for reflection, whether that's within one-to-one supervision with your manager, whether it's peer supervision, whether it's creating sort of a community of practice with members of your team or across agencies, but spaces and places to be able to really start to discuss what neglect means to you as an individual practitioner, what things inform the way that you see neglect. Some of the things we've talked about today, there's the sort of social norms, some of the spaces and places, different cultures. So we can start to open conversations and understand, do we have a shared meaning of what constitutes neglect within whatever organisation we sit within, and, how that might connect to ensuring that we put in place appropriate levels of support for the children and families that we're working with.
Yeah, I would agree with that completely, Vicky. And I think that space for reflection is important, because I think if you have worked in child neglect for a long period of time, you can also almost become a bit desensitized to it. It can become more seen as normal. It's quite important that you stand outside and think about, what kind of levels are acceptable and what kind of levels of care would you want for your own children. And as corporate parents, it's quite important that we remember that.
Well, that's fascinating. Thank you very much to both of you again for coming to talk to me today. Obviously, we would encourage people to buy the book. There is a great deal more information in the book about neglect, about parenting approaches, and everything else that Vicky and Alyson have been talking about today. Thank you very much once again.